My name is Dr Emma Coyne and I'm a consultant clinical psychologist working in the renal transplant unit in Nottingham. My role involves supporting people with kidney disease with their psychological and emotional well-being, and I guess helping navigate the challenges that come with illness, with treatment like dialysis or transplant, and coping with all the changes that would bring to your everyday life. I've worked in renal care for 16 years. Before that, I spent 2 years working in adult mental health after qualifying as a clinical psychologist. During my training, I had placements in pain management, diabetes and palliative care, and I realised how much I enjoyed working in physical health. So when this renal post was advertised, I felt like it brought together all of my special interests. So an average day can take me across the whole of the renal service. I could be spending my time in outpatient clinics, meeting people preparing for dialysis or transplant, or potentially donating a kidney, or just managing the emotional strain of having a chronic illness. I also work in the inpatient wards, supporting people who are unwell, particularly people who are newly diagnosed with kidney disease or facing difficult treatment decisions. Some days I'll be working in the dialysis unit, some in clinic rooms, sometimes I'll be working at somebody's bedside. Wherever I am, the heart of the work is listening, helping people make sense of what they're feeling and finding small ways to help themselves in this demanding journey. Alongside patient work, I support the staff team through consultation, teaching and training, and I'm also involved in research and service development, making sure that our psychological support continues to evolve. I guess the most exciting part of my job is working with people over time and witnessing change unfold. I often work alongside someone for a period of time. So maybe at the beginning they might be feeling very fearful with lots of uncertainty, and it helping them find some hope. So watching a person who's really struggled to find their own footing again, and then seeing them maybe after they've received a transplant, is incredibly powerful. It's those moments that stay with you. The hardest part of my job is knowing, I guess, how much people have to carry when they're living with kidney disease. There's a lot of uncertainty, and having a kidney treatment such as dialysis or transplant can actually change lots of your life. So I tend to meet people at very vulnerable moments, and it can be painful to see how much they and their families are navigating. It can be really challenging at times, but I guess it's also a real privilege to be able to support people during those moments. My role is important because it offers a place for the emotional side of kidney disease, which often doesn't always have another home. Psychosocial care is important because kidney disease affects far more than just the body. Good psychosocial care gives people space to talk, to make sense of their emotions and to feel less alone. That is why we're really excited that from the 2nd of December, healthcare professionals across the kidney community will be able to access a new free psychosocial training course on the UKKA Education Hub. It covers very practical foundations, recognising psychosocial distress, understanding emotional responses to long-term illness, listening well, validating what patients are experiencing, and helping staff to know when to escalate or refer people on. The training was developed jointly by the UK Kidney Association with kidney psychotherapists, counsellors, social workers and clinical psychologists as part of the National Psychosocial Working Group supported by Kidney Care UK. It's designed for all patient-facing professionals, and I think it will help people feel more confident in having those supportive conversations that matter so much. Oh gosh, if I was not doing this, I think I'd still be close to people and their stories. I'd probably be writing more or working creatively to help people understand their inner world. But truthfully, renal feels like the right place for me. It's where my skills fit, and I guess where I feel I can make the most difference at the moment.